Good afternoon, everyone. It's 1:45, so we're going to begin. I'm Kevin Fenton. I'm the president of the Faculty of Public Health, and it gives me great pleasure to welcome you all here today for our 51st annual general meeting. That's almost as old as I am. And it's such a joy to see you all here this afternoon. Thank you for joining us for the AGM and then for the awards ceremony, which will be held later in the day. Today, we have quite a number of things to go through in our annual general meeting. It will be a relatively short meeting, and we'll be doing quite a bit of business, but I hope that you'll both enjoy our reflections on what the work of the faculty, and you'll get a sense of the exciting program that we have ahead as well. So as we begin, there's just a few things to say and to ensure that we get started in the right way. So first of all, I'd like to welcome you all here and a reminder that there are a number of colleagues who are joining us online as well. So a huge welcome to colleagues who are joining us online. This meeting is being live streamed and is being recorded as well. So it is going to be available to all of our members all around the world who are interested in finding out more about the faculty's work. We have a number of officers here with us this afternoon, and I'll ask them to introduce themselves now. I'll just call their names and they'll be able to introduce themselves and their position in the faculty. So I'll begin with Ellis Friedman.
Good afternoon, I'm Ellis Friedman, the Registrar of the Faculty. Does it need repeating?
Yes.
I'm Ellis Friedman, the Registrar of the Faculty.
And Jerry Waldron.
Hello, I'm Jerry Waldron. I'm Treasurer of the Faculty.
And David Chappell.
Hello, I'm David Chappell. I'm the Academic Registrar of the Faculty.
Samia Latif.
Hi, I'm Samia Latif, and I'm the Assistant Academic Registrar of the Faculty.
Neil Squires.
Hello, I'm Neil Squires. I'm the outgoing chair of the Global Health Committee. Liz Mason will be replacing me soon.
Great, thank you. And Fatai.
And I'm the outgoing chair of the Registrar Body, the Specialty Registrar Committee, and Catherine Gomez is not here. Catherine will be replacing me.
Wonderful. Thank you, colleagues, for introducing yourselves. We will be hearing from our colleagues throughout the course of the AGM today. We have apologies for today's meeting from our wonderful Vice President, Tracy Daskovich, who is not able to be with us today. And we also have apologies from Sally Pearson, who is the Assistant Registrar, and she's unable to attend the AGM, but hopefully will be joining us later this afternoon for the awards ceremony. We begin the AGM today by reflecting on our new members and fellows. And this is a time for us to welcome to the Faculty of Public Health and to admit membership to our honorary and distinction members, both from across the United Kingdom and overseas. Now, through these routes to membership, we recognize those who've made a significant contribution, both to the science, the literature, the practice of public health, raising the profile of public health and the work of the Faculty of Public Health itself. So as we go through the course of the meeting today, you'll hear the names of our honorary fellows, our honorary members, our fellows through distinction, and our members through distinctions. The names of those who've received an award this year can be found in the Appendix 1 of the agenda papers, and they're also listed in the following slides. A very, very warm welcome to all of our new members and our honorary fellows and our fellows and distinction members as well. So we'll be celebrating with our new members at the awards ceremony, which follows the AGM at 4 p.m. today. So to introduce you to our new honorary fellows and our honorary members, I'll leave the names up for a minute. Congratulations to our fellows through distinction. Congratulations to our members through distinction. And we have many of our new members in the room with us today, but we want to welcome those who are unable to attend in person but have joined us online. I know we have Ahmed Ali, Ahmed Salim Ahmed Fadil, and Mutaz Mohammed, who's a fellow through distinction. Thank you for joining us for the meeting as well. At this point, we'd just like to take a minute to reflect on members who we have lost since our last AGM. We recognize that we are both a mature specialty and we have members from all walks of life. And unfortunately, we said goodbye to a few of our members in the last year. So join me in just observing a moment of silence for our members who we have loved and lost. Thank you. In the next agenda item, which is agenda item 3 in the AGM, we would like the meeting to note the results of the elections, and we ask the meeting to note the results of the officer and local board member elections. This is in Appendix 2 to the agenda. Now, we'll be working with our colleagues to fill the vacancy for a local board member for the South Central region separately, but I'd like to acknowledge those who have been elected to serve on the faculty. Having been elected to serve on the faculty myself as president in the last year, it is indeed a really great privilege to be asked to serve in this way. And I know that colleagues who will be joining us on the board will both enjoy the experience and the fulfilling roles that we have in the faculty, but will also contribute their passion and their technical expertise and their leadership to ensuring that we continue to grow and be impactful as a faculty. So huge congratulations to colleagues who were elected and selected through the elections. Moving on then to agenda item number 4. This is a Faculty of Public Health Board. The meeting is asked to note the composition of the board for 2023 to 2024. We have co-opted members, lay members, and observers who will be appointed by the board at its extraordinary meeting on the 10th of July. A full list of all board members can be found in Appendix 3 on the agenda. But again, a huge thanks to all colleagues who are serving on the Faculty of Public Health Board, our 7 officers, 13 local board members, 3 general board members, and 3 representatives of the Royal Colleges, of the Royal College of Physicians. And with any board terms and serving on boards, there's always going to be the moment of change and a time for us to say goodbye to colleagues who have served over the past few years. So huge thanks to all our board members for their excellent work and support over the past year, and especially thanks to those officers and board members who complete their term in office today. Some of our colleagues have served up to 6 years on the faculty board, and that's a huge accomplishment. And it just shows the dedication that colleagues who are serving on the board bring to their work on the faculty's board. So a special thanks to Sally Pearson, who's our outgoing assistant registrar, Angela Jones, our local board member from Wales, to Braid Farrell, our local board member from Northern Ireland, Neil Squires, our chair of the Global Health Committee, and Fatai Ogunlai, who is the chair of the Specialty Registrar Committee. Thank you. Moving on to agenda item number 5. And here we look at the annual report and accounts for 2022 and reports on the first half of 2023. At this point, we will begin to receive the annual reports for 2022 and 2023 and oral reports from a number of colleagues. I'll begin with a brief reflection on my first year as president of the faculty. We'll then hear from Ellis as our registrar, David as our academic registrar, Jerry and his treasurer's report. We'll also hear from Fatai from the Specialty Registrar Committee and Neil from the Global Health Committee. Fantastic. So now is the time for me, having got through the business of the first part of the meeting, to tell you a little bit about the work that we've been doing in the faculty. And I think the exciting directions that we will move, both working with you as our members and fellows and colleagues, but also led by an exceptional board. So what I'm going to be doing in a few minutes is just telling you the story of our journey over the past year, some of our core priorities for the 3-year term that I'll be president, and some of our accomplishments as well. So it has been, colleagues, a very, very busy year as we emerge from the COVID-19 pandemic, as we focus on tackling the cost of living crisis, as we think about the significant change that we've had in political leadership, policy leadership, and the resetting of our systems, both here in the United Kingdom and certainly in many countries around the world. I know that you will all agree it has indeed been a busy year. And the faculty hasn't been exempt from this as well. We have done quite a bit of work over the past year to update our CPD policy. A new policy was launched in 2022 to better support our membership. And we have new membership systems that we're putting in place or are developing to ensure that we continue to modernize the way we work with and support our members as well. Supporting the workforce is a core priority for the Faculty of Public Health. We have been advocating for a strong public health system in all of the nations in the United Kingdom, especially in the advent of the COVID-19 pandemic. And as we are focusing on system transformation in all the countries in the UK, ensuring that despite changes which are occurring, we continue to think about the public health workforce, capacities that we need, and ensuring that our workforce is fit and well for the journey and task ahead. So I want to acknowledge all of our colleagues, both within and outside of the faculty, that have been working to support our workforce activities. As a body, we continue to focus on setting standards for the training of public health practitioners here in the UK, and we set standards in partnership with our global partners to facilitate postgraduate training in public health as well. And we have continued to be actively engaged in our work in supporting the workforce, either through accreditation, revalidation or exams, the appointments of consultants, and ensuring that the exams that are provided and are being provided have recovered from the COVID experience, where we had to shift a number of our exams online, use digital or new methods to deliver those exams. So we've been able to get back on track with how we deliver our examinations in the wake of the COVID pandemic. We continue to work with our special interest groups or policy subgroups, which are comprised of members of the faculty who work together on a number of key policy areas of interest to our members. And through that work, we cover quite a significant amount of policy areas and contribute to building knowledge, capacity, and engagement of members around key policy priorities. So I'd like to acknowledge all of you who are involved in our special interest groups and subcommittees, and we are evolving those special interest groups. New special interest groups are going to be created to really reflect the new challenges and the new opportunities that we have as well. We continue to be actively involved in advocacy over the past year, both in terms of advocacy for public health systems, workforce development, and taking on new policy initiatives, which I'll discuss shortly. Globally, we continue to have strong relationships and partnerships with the WHO, the International Association of National Public Health Institutes, and many others, which are involved in building public health capacity, the postgraduate training of public health workforce, and thinking about standards for multidisciplinary training in public health. So I'd again like to acknowledge the work of our global partners in this endeavor. We continue to have a strong organization, looking at how we navigate the financial challenges of the pandemic, ensuring that we provide excellent value for money for our members. We've been able to hold the membership fees steady for the past few years, recognizing the uncertainties and the difficulties we've passed through. But we have continued to innovate and continue to look at more effective and efficient ways of running the organization, of which I'd like to thank James and the staff and colleagues in the Faculty of Public Health. And finally, our partnership working continues to go from strength to strength in the faculty, building those partnerships that we developed during the pandemic, strengthening them and thinking about the next range of partners that need to be a part of our journey to improve the population's health and tackle inequalities. So If anyone asks what the faculty has done for us lately, I think this is a really wonderful summary of some of the areas that we're operating in and the impacts that we're having both here in the UK and with our partners overseas. Now, all of these activities align to the faculty's strategy, which was published in 2020. It's a 5-year framework for thinking about the strategic impact of the faculty. It's built upon 8 pillars, as highlighted here, which really articulate what we do as an organization and where we want to have impact. So whether it's the things we do for people, membership and workforce, or role in promoting knowledge and advocacy, the work we do overseas, or what we do to create a strong and healthy organization. All of this is contained in our strategy, and this is our North Star, which guides us as an organization on what we're hoping to achieve. Now, as a new board, we have been really focusing on a few areas where we would like to have enhanced impact, greater impact in the years ahead. And as part of this, we have taken the board strategy and identified 5 key areas where, as members and as fellows, you will see, hear, and feel the faculty more operating in these spaces. The first of these is a resolute focus on our people, ensuring that we continue to support the development of resilient and inclusive workforce here in the UK and around the world. And part of that is thinking about the well-being of the workforce, especially as we've exited the pandemic, where many of us are tired, having done quite a bit of work in getting through the pandemic, but also moving straight into the cost of living crisis. System transformation is taking its toll on the public health workforce. So we really want to continue to support that. And of course, ensure that we have clarity in the career pathways for public health graduates, trainees, and specialists here in the UK. Second, as I mentioned earlier, focusing on our partnerships, strengthening those partnerships, expanding those partnerships, and looking at innovative relationships that we will build when it comes to the public health workforce, whether this is in dual accreditation, for example, with general practice in public health, or whether it's in bringing new professions such as population health experts into the faculty home, so we continue to create a very strong relationship with our members, both within public health and outside. There are 5 policy areas which are going to be of real critical import to us in the year ahead. First is tackling poverty and the cost of living crisis. Second, ensuring that we continue to work with the NHS on prevention and population health. Third, long-standing commitment to climate change and health, with a specific focus on climate justice, recognizing that the impacts of climate change are not going to fall randomly in the population, but which will be felt by the most disadvantaged within our communities. Tackling inequalities and making absolutely clear that racism is a public health issue, and public health approaches to anti-racism as part of what we do in tackling inequalities will be a key narrative and priority for us as a faculty, and of course, promoting living healthier and longer across the life course. We're launching a couple of exciting programs this year as well, and we've been doing work over the past few months to refine these programs and to ensure that we, in all of the work that we're doing, we find space to celebrate the work of public health practitioners, and we also find the space to inspire current and future practitioners in public health. So later this summer, we'll be launching a new initiative called What is Public Health? Title may change a bit, but the sentiment is there. It is about emerging from the COVID pandemic, being confident about public health practitioners, the work that we do and the impact that we have, and ensuring that we capture the stories of our public health practitioners, whether working locally, nationally, or globally. So if you'd like to feature on our website, on our social media feed, or to tell your story about what you do and the impact that you're having, this is a space that we'd like to create for our practitioners. But it also is an opportunity for us to define public health in the 21st century. The second initiative was launched last week, and it's a series of distinguished lectures, which will bring thought leaders from around the world to tell us about new directions for public health practice, new opportunities for our field, and to think about what we might do in a post-pandemic world to continue to evolve our specialty. So hopefully many of you were able to join us for our first distinguished lectures, which was given last week by Professor Kamara Jones, a wonderful moment where we had hundreds of colleagues online listening to and engaging in, as I said, new areas of our practice. And for our inaugural lecture, we focused again on public health approaches to anti-racism. Finally, in terms of the broad focus area, we'll be continuing our global health impact, working with global partners, global leaders around public health workforce development, training, capacity building as well. So I'm going to end by quickly just reflecting and giving examples of the amazing work that's been done by the team over the last year. In looking at the work of our people, we are very concerned about differential attainment as colleagues are progressing through their training in public health. We know that public health is one of the most sought after specialties. And for every person who is successful in getting into our training program, I believe that there are about 10 others who are unsuccessful in getting on. So it makes us one of the most desirable specialties. Now, what we also know is that as you are progressing through training, we're losing some of the diversity and richness that makes us such an amazing specialty. And we're seeing where at different points in the selection process, some of our colleagues are not performing as well as others. So we've been able to look systematically at equality, diversity, and inclusion in the recruitment of our specialty, and we're putting in place now programs to address this. We've been hosting a number of seminars, symposia to really bring to light our core policy priority areas and our advocacy areas. Here is a symposium that we held recently focused on tackling poverty and the cost of living crisis. But again, looking at the unique role that public health practitioners play in this space and what we as a group of colleagues might be doing to set that public health agenda and to work with our partners on addressing it. I've mentioned the new program, which is our Distinguished Lecture Series as part of our Future of Public Health discussions. The next will be in the autumn, and I'd like to encourage all of you to join. I guarantee it's going to be a great speaker, and we're going to have a fantastic discussion on another topic in public health. Now, as we prepare for the elections next year, as we think about the election cycle and ensuring that we're clear about our policy asks for any new administration, we're doing quite a bit of work now on clarifying our policy requests and, of course, engaging with policymakers to ensure that public health continues to land well. And this is just a sense of some of the assets that we've developed over time. In terms of our global health impact, we continue to work on tools and resources on capacity development for public health workers globally. This is just an example of work we've done with a number of partners on national workforce capacity to implement the essential public health functions during and including a focus on emergency preparedness, planning and response. So really fantastic resource with our global partners. So colleagues, I'm going to draw this to an end, just to give a sense, as I said, of the work that we're doing as an organization, the energy that we're bringing to the role, the passion that we have for the work that we're doing. In the year ahead, we will have new board members. I'd again like to welcome our new board members. We will be developing our website. We are redeveloping our website and updating it. And our e-portfolio system for trainees will also be redeveloped as well. So keen to ensure that we're communicating with you as members in new and exciting ways, but also ensuring that you know what the faculty is doing and you're kept abreast about the exciting work that's being developed. We will continue to have a strong advocacy voice. We've set out 5 areas where we're going to have an enhanced visibility, but at any given time, there are lots of issues which we're having to deal with and respond to. And I'd like to thank our colleagues in the special interest groups for their support in being agile in responding to new advocacy issues and threats. We, as I said, will develop our new work streams and we will continue to work on our membership well-being initiative. That will be the next big lift for the second year of my term. So we will continue to work with partners across Royal Colleges, but also public health partners to think through our approach to workforce well-being. We will continue to work on equality, diversity, inclusion, and continue to have a strong visibility in place, working with our local board members, our regional partners, and our local communities as well. So in ending, and this has become a part of my standard pitch in the last year, ask not what the faculty has done for you, but what you can do for the faculty. And there are a number of areas where I'm always encouraging colleagues to become involved with. I have to say, I do thoroughly enjoy working with faculty, colleagues, staff, the board members, learning from them every day, but also seeing the impact that we have through the engagement with policymakers, with professionals, with communities. And it's an exciting place to be. So if you're interested in becoming a board member, part of our special interest groups working on policies, a committee member, an examiner, a CPD or continuing professional development advisor, there's so many ways you can become involved. And view this as a way of making this, the faculty as a membership organization, the best we can be. Thanks, everyone. I'll hand over now to we'll hand over to our registrar, Ellis.
Thank you, Kevin, and good afternoon, everybody. So I've got a lot to cover, but I'll try and do it in 5 minutes. So first of all, I want to say that we've made quite a large number of improvements in the efficiency and effectiveness of the organisation in my first year in this post. And that is, of course, in no small part due to the help and support I've received from many colleagues and staff. I can't name them all. Obviously, Sally, my deputy, is one of those. So let me just list some of those achievements. We've updated all model job descriptions. We have now got a much more complete and up-to-date register, supported by much better IT. We've improved the training and frequently asked questions for both advisors and appraisers. We've improved the feedback to unsuccessful candidates. We've now got a data sharing agreement with Scotland, so we're now getting routinely information from Scotland on AACs, advisory appointments committees. And we're now beginning to turn some of that information more into intelligence. So, for example, we've already done an analysis of that database of AACs on pay, and that will be extended to issues like gender, ethnicity, which posts aren't being filled, which are most likely to be successful if you are a new registrar who's just completed their training, for example. So we've achieved quite a lot, but there remain many challenges. We estimate, and we only can estimate roughly, that perhaps 20 to 30% of consultant posts are unfilled. And clearly there is an imbalance between demand and supply. Partly that's a good reason that the pandemic has made employers and others recognise the greater importance of public health and want more posts. So that's good. But at the same time, we have an age structure, which means that many people are retiring. And then there is also a problem. Obviously, it's patchy, but there is a problem of morale, partly again caused by the issues of COVID. So even though we have managed to get the highest number of higher specialist training posts, 122 in the last year, those may not be recurrent, and there remains an issue in terms of recruitment and retention that I and others on this panel have to address with your support. So the next slide, I hope somebody is, I'm doing that, am I? Sorry, it's all right. I thought I had somebody who's going to do that for me. So we have an issue with morale, which Tracy, who can't be here today, is leading a group looking at that issue in particular about what we can do to make people's working lives better of our members. And we recognise that there's a long-standing issue in terms of inequity between those people who are registered through UKPHR and those through the GMC. And we have taken a number of steps to try and address that, which at the moment, it's too early to know how successful they will be, but it's certainly an issue on our agenda. I'm pleased to say that the inequity of defined specialists not automatically being offered fellowship, that has now passed, and so we've overcome that long-standing inequity, and I'm very pleased that that is the case. In terms of lapsed members, which isn't a big issue, but it's also disappointing when people leave the faculty who are still in active work, we can no longer, for those people, we don't know whether they are maintaining their professional competencies and therefore merit still being classified as public health specialists. And so those people are routinely being reported to the ROs or registrar, and it's up to them to decide what action that they should take. So we also, of course, have a new online CPD system and a new, less bureaucratic CPD system, which is much more focused on learning rather than being somewhat punitive in the past. And both of those initiatives have gone down extremely well with our members, I'm pleased to say. Our revalidation process for the minority of people who have to use the faculty, again, that gets a very good feedback in terms of the quality of the service that is produced. So I think we've got quite a lot that we can be happy about in terms of how the revalidation and appraisal systems are going, and the numbers being revalidated by the faculty. Not that that's a metric that we particularly look to, but that is going up slightly. So then the last slide is basically, that's for me to do, is basically for me to say that as a result of all of that, you won't be surprised to learn that having a workforce strategy which looks at both the short, medium and long-term needs of the faculty and its partners, because we work with many partners in terms of taking forward the public health workforce, that is perhaps the biggest issue that I would say faces the registrar in the coming months and years. We will be doing a survey, and that survey will reintroduce what always used to be a 2-yearly survey to find out what members think about the services that we provide for you and with you. So that will be reintroduced. It was suspended because of COVID. Now, my colleague, Tracy, leads on governance. She is the chair of the governance committee, but unfortunately she can't be here today. So that's why I get an extra slide. And basically all I want to say here is that in addition to the things that I've mentioned before, there is a joint review, if you like, between Tracy and myself and others in terms of reviewing the standing orders of the organisation. And you will see relatively soon that we are going to revise some of those standing orders, because some of it will require you to vote for the changes that we have put in place. So with that, hopefully I've kept to my 5 minutes, and I'm going to turn on to David for the next talk. But thank you very much.
Thank you. So the first thing to do is to pay tribute again to the fantastic team within the faculty who keep things going. You'll realise that many of the functions under the academic registrar are critical functions like exams and curricula, but they're a bit behind the scenes. As long as we keep everything running fine, nobody notices. People notice when things don't quite work. But we continue to run the diplomate exam, which moved online during COVID and is going to stay online. So, but we constantly make improvements. So, for example, we now put a gap in between exams to increase the to give a break between the days of papers. We're also seeing more people sitting the exam outside of the training programs to become diplomate members of the faculty, both in the UK and abroad. Our membership exam has shifted online and then back again now. So that's being run very successfully face-to-face in a number of centres in London and Liverpool. But again, there's learning from the online exam that's being brought into it. So there's a constant quality improvement of the exams, hopefully. But as I say, when they run smoothly, it isn't necessarily realised just how much work is going into them. The certificate of completion of training, the CCT, there is the assessment at the end of training that we do. And as you can see, we are seeing higher numbers coming through, and that's really positive because they'll be going on to be consultants. And as Alice alluded to, there's quite a few vacancies, but we're also getting people coming through a retrospective portfolio route called the Certificate of Eligibility for Specialty Registration. And that's something that has been hardly used over the last few years. And then suddenly last year, and this year, we seem to be sort of up to half a dozen. And actually, they are a huge amount of work to assess. So that's something we're going to keep looking at, but it also means more people coming through to consultant level. So some of the core things we do, the curriculum, many of you know, was revised, took a bit longer than expected because of COVID, but it's now the 2022 curriculum, and we will be assessing that this year. And we've tweaked the current e-portfolio, but we'll be commissioning a new e-portfolio. The current one is essentially getting to the end of its life. Recruitment, you've already heard about that. We enrolled 95 registrars this year, but actually there's going to be over 120 from August. But there were more than 10 applicants for every place, and that's a huge undertaking which is undertaken by NHSE on behalf of the 4 nations to work through all those applications and to make it run fairly. And as Kevin alluded to, we've been trying to look at that and make sure the processes are as fair as possible. And it's all done online now. So that's something I think was probably here to stay. So on that is one of our fair training culture is the term that the GMC has used. And I think it is a good term because it's a positive way of thinking about what we're trying to do. It's there are lots of terms like differential attainment, but actually it's all about a fair training culture. So it's going to be a big and long-term task. As mentioned, there's already a report looking at the recruitment pathway, and there's a lot of work as a result of that to try and rectify some of the issues there. And we're going to, there's already work looking at our exams. So hopefully later this year, we'll be publishing some more data on the fairness of exams and looking at progress through training, through the annual review, competence progression, and other measures of our culture. So that's one of our big tasks and aims this year. I'll leave it there. Gary.
Thanks very much, David, and you've gone straight to the money, as it were, because past the introductory slide, but that's great. This time last year, I was down there somewhere, different venue, and I'm just thinking it's amazing how quickly the year has gone. Here I am looking at talking about the faculty's finances, the kind of boring stuff, but you want it always to be boring because you really don't want anything exciting happening in the funding. But in the same way, a lot has happened during the year, and I couldn't let the opportunity pass without, in my first year as treasurer, giving this is like a running theme from everyone on the panel here, but my great thanks to faculty staff who have made what could be a difficult job extremely easy. Kajal is in the front row. She started very shortly after I took up the post, but she's been absolutely a wonderful support to me during the year. And I'd have to mention George as well, who's in the back row. This is George's last day with the faculty. So thank you very much, George, for the work during the year. And we've got Colin as well, who has just joined us, and looking forward to working with him during the next year. Also, all faculty staff, won't name any more names, but I'd like to also thank my colleagues on the Risk Management, Audit and Finance Committee. We revitalized that committee a bit. I had to say to people, please join this committee. It's not the most glamorous committee that the faculty has, but in my view, it's the most important, because without the money, we couldn't do all the wonderful things that everybody else along the line is doing. Now, this is the story. The bar at the end wasn't there last year. And we were looking at Ellis's tenure and just seeing it going up and up and up. And then Jerry takes over and look what happens. But actually, we expected this to happen, and we're not a money-making organization. I can tell you we put the difference to good news or to good use, and more about that later. But I suppose in a way it is a tribute to Ellis, and I should, this is like a mutual congratulations thing, but I should thank Ellis because he really made things very, very easy for me. He, even before, a couple of months before I took over the role, I was an observer in all the committees, and it was a great introduction, and it made me taking up the role an awful lot easier. The bottom line on all of this that isn't in the bars, we are financially healthy this year. We have an independent, our books are independently audited every year, and we got a clean bill of health, and we are in good shape and in good stead with the charity commissioners. So everything okay there. I should also say, and this has always been the case with the faculty, but any members, any board members and whatever, our accounts are open. It's an open book, and I am more than happy to deal with any issues, queries, or anything else that comes along. So on to the highlights. If I can press them, if it works. There we go. The highlights of the year. We're implementing the financial strategy. It's ongoing, as it were, and we're continuing. We have an operational surplus in the year, not as big an operational surplus as the previous year, but again, that's not a surprise, as I mentioned. We have held subscriptions at the same level for a further year. Now, that won't always be the case, I'm afraid. We cannot do that and continue to do the work, but I think we can give an undertaking that any changes we make in terms of the membership subscriptions will be in line with what we feel is appropriate to do the work of the faculty and taking into account the pressures, financial and otherwise, that the members are under. As I mentioned, we had a very healthy and a positive external audit reports. You've heard already about the significant achievements on infrastructure improvements like the CPD, the e-portfolio is coming up. We have appointed people to work with us to improve our website. All that takes money, but it's money well spent. And something that's very, very close to my heart was the revision of the investment policy. Now, it was fine as it was, but I think we needed to be a little bit more specific in terms of things that we weren't going to invest in. Someone brought up at the away day last year about gambling. That wasn't specifically excluded, but we weren't investing in gambling anyway, but it is now specifically excluded. But also, I think when we're talking about ethical investments, we don't just think about the negatives. We focus on the positives, and we focus on investments that sustainable developments, whatever. We have to look at the positive side of ethical investments as well. And we are taking steps to ensure that our investment partners are taking account of that. And finally, I mentioned about the revised and invigorated risk management audit and finance committee that we've done during the year. We had a number of vacancies. I don't know how I did it, but twisting arms, whatever. I encouraged people to take up roles, and I got an amazing response. Extremely grateful to colleagues for doing that, because, you know, I haven't got a day job all the time myself, apart from being treasurer, but other people have day jobs and very busy day jobs, and really very much appreciate the fact that they'll give up their time to work with the faculty on a committee and on an important committee. But as well as that, I was very keen that we should recruit lay members to that committee, particularly the nature of the committee. I mean, I haven't got a financial degree. I'm not sure how many faculty members have financial degrees or qualifications either. I would guess not too many. So we need to have a little bit of independent oversight, and we were able to recruit 2 lay members, Kathy and Sheila, who have extensive financial background. And my goodness, they really hit the ground running. They really did. And they've been a tremendous asset to the committee. since then, and I'd like to give them my thanks as well, and to really look forward to another exciting year ahead. You say exciting with finance, not in that way. A nice dull year ahead, working with everybody else. So just a general thank you to all of you, and for all the work you've been doing and for your support.
Okay, thank you. So my name is Fatai, and I'm the chair of the Specialty Registrar Committee. And I think, yes, an acknowledgement to the efforts in echoing to what's been said already in terms of the faculty officers and the work and the support that they've given the registrar body, particularly, I'm going to embarrass you, Julian and David, for your continued support and engagement with us in addressing some of the training issues and items that David mentioned. But it would be remiss of me as well if I don't mention the incredible efforts of the registrar body more widely. I've been privileged to have been involved in SRC since the start of training and taken on the leadership capacity for the last 3 years, initially as the vice chair and more recently as the chair. And I'm just in awe of what registrars do under the banner of training, but incredible leaders. I know we talk about them as future leaders, but they are already leading systems in places that I see. So I want to give acknowledgement to that. I know there are some registrars present, particularly Dahlia, one of the vice chairs, sitting quietly in the background, who's one of the stuff I'm about to talk about wouldn't have been possible without your efforts. So thank you, Dahlia, and to registrar body. I'm going to really briefly talk through some of the key highlights for this year, but I invite you to use the QR code, the URL, whatever people do nowadays. Take a picture. If you're from home, copy and paste and have a look at our annual report, our annual SRC report, because that goes into more detail in terms of key achievements this year. But I will run through really quickly this slide, highlights of some of the key achievements this year. 5 things I wanted to mention, but 2 of them, I refer to them as our enablers, the foundation that allowed us to do some of the work that we've done as a registrar body. And that's around our governance process and our increased influence or relationship with the faculty. Over the last year, we've worked incredibly hard. It's not the most exciting thing to do, but important nonetheless, to get our house in order as a registrar committee, because there's a lot of incredible intelligence that we gather, and as registrar turnover, we lose some of those organizational memory. So we've done an incredible amount of work in our internal governance, in our terms of reference, in our documentation. And one of those is actually setting out a multi-year work plan so that we can have continuity in what we're doing. And that's something I'm particularly proud that we've achieved under the leadership this year, particularly with our SRC Vice Chair, Dahlia, in charge of that. The other is around our influence, because we can only function as an SRC whose primary purpose is to advocate for issues that pertains to registrar in the faculty infrastructure, and also in organizations, external organizations, where there are discussion around public health training or the future workforce. So this year, we've worked really hard to build on an even closer relationship. I mean, we've always had a good relationship with the faculty, but we've improved that even further. And I'd like to acknowledge, Kevin, your incredible commitment when you were first elected this time last year. And I think we were at the AGM when you made the commitment that the SRC will be your priority. And within the first 100 days, you fulfilled that, because you joined us for one of our meetings, and we've continued that with David and Julian and James supporting that. So I feel particularly proud to be part of a faculty that values the views and the voice of registrars. But look in the report, because there's a lot more details in what I'm saying around that. And in the 3 key areas that we've then done on top of those really solid foundation is around workforce support and development. How are we supporting registrars? And David's kindly mentioned the day break that we now have between our 2 exams. And that came directly from registrars telling us the impact the gruesome exam has on their well-being, particularly those with long-term chronic conditions. And if you're not in that community or part of that population, you were completely blindsided by that. So I'm pleased that faculty has responded to that, and we now have a day break between exams. We also talk about returning the membership exam to in-person, and we've been working with the faculty to think about how do we make that more inclusive? How do we rotate that across the country rather than in just one place? So again, really proud of that. And then really lastly, for today anyway, on that point, is having a platform to share more amazing work that the registrar are doing. So on the 21st of September this year, there will be a National Registrar Conference where we can really celebrate some of the fantastic work of registrars, but also do a little bit of horizon scanning. What are the future challenges? How do we equip our future leaders to be ready, system leaders to deal with that? So 21st of September, there is a link in that report that I mentioned where you can click and register if you haven't already. So two quick things, one around training equity, working incredibly hard. Kat is not with us today, but she's been working with a group of registrars looking at reasonable adjustment for those registrars who require them during training. How do we make sure that they're best supported the best way? Evidence shows how. And there's a report that's going through consultation now that's being worked on. And I'm not sure if Kazim is here or is working, watching remotely, but seeing our registrar take a leadership in the EDIC and working closely with the faculty, with the SRC. Again, it's something I'm incredibly proud of that we've done in the last year. And then finally on this is just observing over the last few years how quickly local issues can become national and global issues through the recent pandemic. It felt really key that we strengthen our partnership with global networks of other registrars, early career professionals. And particularly wanted to say thank you to Neil for the platform you've given to registrars to be able to do this. And there are others in the room. I know Farhang is at the back there, who's allowed registrar body to be able to have this platform on a global stage. And that's translated into collaboration, partnership. And I won't say too much about that because I know, Neil, you will touch on that in your session, but particularly proud for that, for those connections that we've made over the last year. Yeah, I couldn't not just embarrass them and stick some pictures of registrar up. And they genuinely have been incredible. I know it's me standing there now, but it's through the efforts of the registrar body. Thank you very much.
Thank you, Fatai. And on the last of these presentations, before we get a chance to ask some questions, this has been, I'm stepping down and handing over the chair of the Global Health Committee to Liz Mason, who will do a great job. She comes with a very strong track record in global health, and we've had a refreshed Global Health Committee as one of my last acts as the chair of the Global Health Committee. But this has been a long journey. It's nearly 7 years now in this role. And I remember a meeting in 2017 where we met with WHO, with the Association of Schools of Public Health in the European region. And we talked about the importance of building public health capacity globally. You will have seen in Kevin's presentation that the global ambition is to build global public health capacity and capability. We're very privileged in this country to have a multidisciplinary, competency-based public health training program with 5 years that builds up those skills and competencies. It's linked to solid professionalization of the public health workforce, which brings appropriate recognition, which is necessary to have the credibility to argue for public health. That is something many countries in the world do not have. A master's in public health might be the highest qualification, PhDs in some countries. But the opportunity to support and develop competency-based, multidisciplinary public health training globally is what we've been looking to achieve. You will also have seen in Kevin's presentation the picture of the global roadmap for public health and emergency workforce, which really is the culmination of a long journey to ensure that we're promoting globally this multidisciplinary competency-based public health workforce to expand the global community of people who can be partners of the faculty. We already have over 400 members of the faculty who are international members. So part of our role in the Global Health Committee is to ensure that they're actively engaged in our work and we have something positive to offer them. We have a number of special interest groups who are geographically focused, who are engaging with populations across the world, often with diaspora links to the UK, so bringing that strong link in. But obviously, one of the main things we want to promote is quality public health globally to influence systems and shape them. And I think that is beginning to happen. So just to highlight some of the main achievements, the big one, and this has been supported very much by the response to COVID, is the recognition of the important role that public health plays in counteracting pandemics, but responding to many other health hazards and threats. That has included a recognition that without a workforce, a capable workforce, you will not achieve significant change to public health systems. And so there is a global effort to build up that public health workforce, backed by World Health Assembly resolutions. WHO 69.1 has really emphasized the importance of having a strong public health workforce. And you will see over coming World Health Assemblies that that's now embedded in the strategies to address future pandemic threats, with a lot of the funding, such as the new pandemic fund, being geared towards investing in the institutions and structures necessary to achieve that strengthening. So partnerships are critically important. We've developed strong partnerships with WHO, who've looked to the faculty for that advice on competency-based training. We've developed strong partnerships with the International Association of National Public Health Institutions as an institutional home for those trained public health professionals is important. So these are global networks that can help deliver this agenda. Education and training, we've drawn on the capability of David and colleagues from the faculty in order to make this happen. And the faculty team has actively supported this. Caroline Wren here in the front row, without her constant support, the Global Health Committee's work would not get done. So a big thank you to Caroline. But we've also drawn on capabilities from across the organisation. But all of this is about members' own capability. And the faculty is nothing without its members and its members' time who help us to realise some of these achievements. Just to give some indication of the achievements with the sticky green button. So this year, following on from the development of the roadmap on public health, there was the World Congress on Public Health in Rome, where FATI showed a very strong leadership role representing the UK faculty with early career professionals globally. I mean, this is a major shift to have that recognition of the importance of early career professionals in shaping the future of public health, which is the future of public health that they will lead. So absolutely important that their voices are shaping that agenda. And there's a strong global network now of early career professionals actively engaged in developing this future roadmap. We've had a number of MOUs signed through the work of the special interest groups, an MOU with South Africa. We've developed a new MOU with FPH, which is working in the Eastern Mediterranean region. And there's been some very practical work with Malawi asking for support to develop its public health training, which certainly warms my heart. I started my career as a district medical officer in Malawi, so fantastic to see public health training developing there. So a huge amount of achievements that have been realized. I can see the chairs of some of the faculty special interest groups. This is all the work of faculty members, and I know that Liz Mason will continue the work of the group going forward. So thank you. And I think we now have an opportunity for questions.
Thank you, Neil. Thank you, colleagues. So we're coming to the end of the AGM, colleagues, and we have just 15 minutes for questions. So we had some questions which were submitted beforehand. So I'll take the opportunity now to ask them to or offices, after which I'm sure in the audience, having heard the fantastic program that we have, I'm sure you also have questions as well. So hopefully we'll get a chance to hear from you and any questions you may have about the business of the faculty or strategic direction and what we're hoping to achieve in the year ahead. So the first question is for David. Noting the publication of the report into EDI in recruitment to specialty training earlier this year, please can you outline the faculty's next steps for this important work?
Thanks very much. That's a really important question, and in fact we were having discussions before we came in about the challenges of this. So one of the things you'll have realized is that the faculty is in control of some things like exams, but in other areas we advocate for improvement. So NHS England runs the recruitment process, and we've worked closely with them to produce help produce that report on the recruitment process, but ultimately they have to make the changes to their processes. It involves constantly looking at, there are a set of recommendations report, and some of them have been implemented, such as improving the situational judgment test, and others need more work to implement. And that's kind of where we are in that report. And just to pay tribute to the whole range of people helping with that, not least the specialty registrars on the ED&I SIG, who've been really advocating for better ways of recruiting. And so I think as the realization, I guess, is, and maybe is a bit naive, there are some quite difficult things to sort out, and it's going to take us a lot longer than I guess I've realized. And there'll be more reports this year, as I alluded to, in terms of other parts of the processes like exams, but the faculty only controls a certain amount, but I think is expected to sort of take that leadership role to making sure everybody is looking at their equality and diversity, and not just looking at it, but actually doing something about the findings. So we'll continue to push on a number of fronts, but and it is one of our major work programs at the moment, but it does involve a whole range of different people in each of the areas to make the changes necessary to make things fair.
Great. Samia, I wondered if you had any reflections as well on the work and your hopes for the work.
Thank you. So we've got a registrar who's actually supporting us with the second phase of this work around fair training, and the report we hope to produce by autumn will be looking at exams and demographics of the candidates that we have and the registrars that we have in our training program. We do have phase 3 and 4 sort of already set out, and I'm going to take this opportunity as a plea to ask our registrars to come forward, because the current registrar is stepping down from this project once she completes phase 2. So this is your opportunity to put the word round there. And for educational supervisors, if you could also support your registrars when they engage with this work.
Wonderful, thank you. So colleagues, this is a priority for us. We will keep this on the agenda in the AGM, so you'll have an update every year on our progress. And we will also update you throughout the course of the year as well through our newsletters and on the website. So as we have new products, as we have new policies or new results, we'll be sharing this with you. But this is a priority for us to sort. We're not the only Royal College or faculty that has this. But what we want to assure is that we are among the faculties and Royal Colleges that are acting deliberately and working, as you say, David, with our partners to address the issue. The second question is for me, but I'll say that to the end. It's for Jerry. Jerry, the faculty has not increased subscriptions for a number of years now, for which I'm sure the whole membership is grateful. In light of the cost of living crisis, are fees likely to stay frozen, recognizing that costs have increased for the faculty as well?
Thanks, Kevin, and thanks to whoever submitted that question. I think it's membership fees are the kind of perennial concern in terms of cost of living. We have managed to hold them at a steady level, unlike many other colleges, I dare say, but that isn't sustainable forever. But just to state, it will be, any changes to subscriptions will be, and when I say changes, There may be differential changes, there may be increases. Who knows, there may even be a decrease, but I don't think that's particularly likely. But it will be on the recommendation of our committee and made to the board, and it will ultimately be a decision by the board. But the principle that we're working on, the principle that we must work on, is to take everything into account. As the question implied, we need to balance the work that's done by the faculty, which is a cost, and it needs to be paid for. And the principal source of income that the faculty has is membership fees. That will always be the case. I mean, I look at other colleges and organizations who have sumptuous premises that and have a considerable income, for instance, on weddings. Now, I don't think we could start doing weddings in our own venue, but who knows? Maybe someone would like to get married there, and we can make some money out of it. But seriously, we really do need to balance that. But we need to take account the needs of our members as well. And I suppose the other thing to say is that if any member genuinely is suffering from financial hardship and feels unable to pay the faculty fees because of that, they should be getting in touch with us at a very early stage so that we can see if we can do something to help them out on that.
Great. Thank you very much, Jerry. A really important last sentence there. In addition to everything you said, please work with us if you're going through any difficulties at this time. We recognize it is a very challenging time for everyone, our members included. So please do get in touch, colleagues, if there are any concerns. The third question, Ellis, is for you. Now, some years ago, the faculty surveyed all members to get their views on the Faculty of Public Health and the value of membership. You mentioned earlier that there are plans to repeat the exercise. What sort of opportunities could colleagues have to get involved with this work? What are?
Yes, so thank you for that question. The board, myself, the executive team, clearly we're very interested in the views of fellow members. And we particularly would like a large response from fellows and members to the survey, which is planned to go out later on this year. As you heard, it had been suspended because of COVID, but we're intending to restart it and then to hold it every 2 years as we've done in the past. And I would like a large response because obviously we could then draw firmer conclusions from what responses we receive. That means that we can't expect the survey to be too long, because the longer it takes for people to fill out, the less likely it is that we will get responses. We will retain some questions that have always been there because we want to have an ability to do a trend analysis, but there will be new topics that we will include. So, for example, it's likely we'll include a question about working from home, a question about climate change, which haven't figured in previous surveys. But I'm always interested to learn of the ideas that any member might have in terms of what we might include within the survey. There is a group which represents all of the 4 nations of the UK and other key representative groups in formulating what the new survey will be. So I would ask you to get any ideas into me as soon as possible. So send it to me or to Julian, who is helping me coordinate the work on this issue. Thanks.
Wonderful. Thank you, Ellis. So I think previous response rates were in the 30s or 40%.
It has been as low as 20%.
Okay.
So we clearly, when you recognize that, it is very difficult to draw conclusions when a survey is only getting as little as 20% response rates. So we do hope to make the survey as engaging as possible, but we rely on you to assist us in responding so that we get a true response where we can draw some significant conclusions from the feedback that we get.
Thanks, Ellis. Now, let me just put a plug in here. This is the Faculty of Public Health. If anybody can do a survey, we can do a survey, right? And because we often give surveys to our local communities to complete, I think we should do unto others as we'd have it done to us. So please encourage your colleagues or members, for those of you working locally, to encourage your colleagues to participate in this. We need a really strong response rate. in part as LSS to understand our agenda and refine our agenda. But I'd like to also have the survey in 2 years' time to see the impact of our activities and to use it to evaluate the work that we're doing in the faculty. So let us aim for a 60% response rate this year, if not more. I think that's the least we can ask for or should aim for. Any questions in the room before we close? Yes, there's a question. We'll get a mic to you. Okay. If you could introduce yourself, please. And
I'm one of the new honorary members, so thank you very much for that. My name's Jane Corbett. I'm a councillor in Liverpool. I just wondered whether I was fascinated by the special interest groups, to be honest with you, and the way that actually I presume that they all link together as well. So you look at how all of those overlap. And I wondered if there's anything in there that links up housing with chronic stress, which also links up with obviously poverty, climate change, but also the amazing global partnerships you've got as well. Yeah. But it's how housing fits into it, really, if there's anything in there.
Yes, there would be, because housing would cut across quite a number of the special interest groups. We have a group on equity, diversity and inclusion, health inequalities. We have a group that focuses on health improvement. So how do we improve health? So both of those would be looking at issues related to housing and health as well. And then we have a lot of partnerships with external colleagues who are working in this space too. So whatever you're interested in, there is a home for you in a special interest group. And for new members and fellows, I'd certainly encourage you to join. Any other question? Thank you for that. Yes, at the back, last question. We'll get a microphone to you for online colleagues. Thanks.
Hi, Abraham George from Kent County Council. I was just wondering what's the faculty's position around the emerging rollout of the National Population Health Management Program, and how does the faculty public health view that, given there's the leadership of that program is particularly who are all directors of population health, they're not actually trained through public health. And actually, does the faculty have a position or a viewpoint in terms of the definition of population health versus public health?
Great, thank you for that question. So we do have a position, and we do have areas of work which are really prioritizing this. So for colleagues who are not aware, with the transformation taking place in the NHS at the moment, the creation of integrated care systems in England, but also across all nations, we are seeing the NHS employing more people who are leading on population health and population health management. Many of those individuals may have a public health background, and many don't have a public health background, but they intersect and overlap with the work that our public health practitioners are doing in the NHS. So this is a fantastic opportunity, I said earlier, of widening the tent and welcoming colleagues who are working in population health management in the NHS, looking at their training, capacity building, linking them to public health practitioners, doing some work, as you say, on the definitions of public health and population health, but also thinking about the support they may need to do their jobs as well. So we're working through our healthcare public health subcommittee and special interest groups to really think of the work that we're doing in the NHS. And so if you'd like more information, I'd be happy to point you through to our colleagues who are leading in this space. So we have one final question, and that's my question. I thought I'd end the session on this. So this question is, Kevin, you're now a year into your presidential term. What is the one key area of learning you have had, which you will take forward and use during the rest of your term? And also, could you identify one thing that has surprised you in your first year? So the one area of learning is just how, given the shared experience that we all had of going through the pandemic, I've been learning a lot about the resilience of our members, the resilience of our colleagues under really challenging circumstances. We've gone through the pandemic, the cost of living crisis, reorganizations of the public health system, reorganizations of the NHS. And every time I go to a site visit in our regions, every time I go to a community, I get a group and a room full of passionate public health people who are committed to making a difference, who understand that actually, now is not the time to give up. but they need to continue fighting and to do so in a passionate, fun, creative, and impactful way. So I've learned about the resilience of our members and really inspired and blessed by that. And in terms of what I'm going to be taking away with us, if anything has surprised me during the first year, no, nothing has. And that's a good thing. So colleagues, thank you so much. It's been a pleasure hosting you for our AGM. We're going to take a break now, and we will be returning at 4 p.m. for the award ceremony, but we're going to ask everyone to take your seats by 3:45. We have an amazing array of colleagues who are getting awards tonight, and I can't wait to celebrate with you. Thanks so much.